Rachel's going to kill for this intro. I'm Rachel. We've been talking a lot today about left hand not talking to the right hand in terms of somebody who's in exercise or as a professional, not knowing or maybe knowing a lot about physical health, but then maybe don't communicate that out to somebody in the mental health profession and vice versa. And hence, that's why we exist as a duo. So Rachel and I got together about 4 years ago, and we're going to present the work that we've been doing in our population, which is veterans with PTSD. The presentations that we've been listening to are the lead-in for our work. We're both just down the street at Marquette.
All right. Hello, everybody. So when I first started here in Milwaukee and at Marquette, we really wanted to try to kind of understand our community, the community of veterans with PTSD that we're hoping to work with and hoping to promote physical activity and exercise behavior. And so one of the first studies that we did was conducted at Marquette at the new Athletic and Human Performance Research Center, where we received a pilot award. And it was a very, very small study, 8 veterans, 7 of which who had PTSD. And we were trying to get a better understanding on their thoughts about exercise and physical activity. If you look through a lot of the literature and the research, we don't have a whole lot of qualitative data really asking veterans their thoughts. What do they think of when I think of wellness, physical activity, and exercise? And, oops. I apologize, this is so small here, but this study, this conventional content analysis approach, which is a qualitative approach, really revealed a few different topics that surrounded veterans' thoughts about physical activity and wellness. And very briefly, we learned that veterans may be a particular group that we need to think a little bit differently about promoting physical activity, really trying to change behavior. As James mentioned, right, everyone knows that physical activity in itself is beneficial, but how do we think of it from a behavioral approach? Are there specific nuances to veterans' experiences that we might need to consider when trying to change or increase physical activity? So in this focus group, we demonstrated that veterans with PTSD, they reported having this idea of selfless service, right? Not wanting to take care of themselves because they are so committed to thinking about taking care of others and performing service to others. Having struggles with negative emotions that precluded their ability to engage in physical activity. And lastly, which was very important, was this idea of holistic care. So maybe thinking about activity and exercise a little bit different than what we tend to think of it. Are there other options? Are there other maybe complementary and integrative health approaches that may be more beneficial for that population in promoting physical activity? And so just to give a little bit of background on kind of some research that has been done surrounding exercise for PTSD. So this was a nice review that was conducted just a few years ago. And there's a lot of research out there, right, just kind of generally in PTSD and exercise. But there's not as much specific when you're looking at just specific samples of veterans. And so this was a review that was done by Daniel Reese and colleagues that looked at a few different studies. So as you can see here, very few studies that were included. There were 6 single-arm studies as well as 3 randomized controlled trials. As you can see, kind of a variety of different approaches, so they kind of encompass exercise in general. And so you can see here in terms of the single-arm studies, there were quite a few yoga exercise regimens that were included compared to that randomized control trials that included yoga, integrated exercise, and as well as aerobic strength. And so this is, oops, sorry, I keep pushing the wrong button. How do I get back out of that? Okay, thank you. So this shows the standardized mean difference. So looking at how does PTSD symptoms change before to after an intervention. And you can see here, when we look at the single-arm trials, we see a standardized mean difference of negative 0.60, meaning that PTSD symptoms generally improved from before to after the intervention. And we see a similar number when we look at the randomized controlled trials, negative 0.40. So same thing, seeing a trend of improvements in PTSD symptoms. Importantly, when we look at these studies, really, we still have relatively few studies that were included in this review. And we also see that when we include the randomized controlled trials, we typically tend to be a little bit more rigorous from a research perspective. The standardized mean difference no longer was significant. So again, we have some data that suggests, when we look specifically for veterans who suffer from PTSD, that exercise is beneficial. But I feel like there's still a lot more data that needs to be collected to show a really strong change in those PTSD symptoms. So another study that I want to mention as well is when we look at exercise for PTSD, as James mentioned as well, is that the dose, right? Or how much exercise is actually needed, how much exercise is beneficial. So this was a study that was conducted again a few years ago that looked at self-reported exercise frequency and PTSD. And this was looked at veterans in the VA system. And this table here shows that number of days of weekly exercise from 0 days reported to 7, and the percentage of the sample overall that had probable PTSD. And as you can see here, right, compared to the veterans who reported no days of engaging in engaging in self-reported exercise, right, engaging in 1, 2, 3, 4, 5, 6, 7 days lowered that percentage of those who suffered from PTSD. But one thing that was interesting that this paper showed was that we see potentially this perhaps U-shaped relationship, meaning that there are some veterans, as you see, who are participating in 6 or 7 days of exercise, maybe are even demonstrating higher percentage of those who suffer from PTSD. And so that really got us to thinking again about kind of the modality, the intensity, that dose, right? What type of exercise really is the most beneficial? Is there something about these individuals who are engaging in 7 days per week that are suffering from specific traumas or using exercise as a way to avoid actually kind of addressing those PTSD symptoms and the trauma that they're suffering from? So, yoga for veterans. Why yoga for veterans? Kind of so far today, most of the speakers have talked about aerobic exercise, resistance training as approaches. And yoga in itself, it kind of depends what camp you're talking to and whether it can be deemed exercise or not. It depends on the type of yoga that an individual engages in as well. But yoga really is kind of that complementary integrative health approach that has been associated with more of holistic care. It kind of targets that physiological health. I don't know how many yogis are in here, but depending on the yoga that you do, can be very demanding between the movement that is required in yoga, as well as some of the poses, the isometric poses that are done as well. But it also addresses that psychological health aspect. So a lot of yoga incorporates breathing exercises and specific meditation that could potentially, again, target for an individual who suffers from PTSD, both things, the physiology, right, having that challenge of an exercise stimulus or a movement stimulus, as well as potentially offering a therapy or approach to target some of those psychological aspects as well. In terms of looking at the research surrounding meditation, that has a lot of research demonstrating its effects, especially for mental health. So we look at, do veterans engage in yoga? This was a study that, again, most of the data that we have comes from VA. So whether veterans are engaging in yoga programs or classes that are offered by the VA. 25% of veterans who use VA practice. More recent data has suggested that number to be even a little bit lower. And when we look specifically at chronic pain, which we often see a little bit higher engagement, those numbers are about the same. 14% practicing, but also people that are interested in potentially using yoga as a therapeutic approach. So what does the data say so far? When we look specifically at yoga for veterans with PTSD, to date, to my knowledge, there have been 7 randomized controlled trials as well as 5 single-arm interventions. Most typically, as is often the case in looking at exercise physical activity for PTSD, the primary measure tends to be PTSD symptom severity. And across those 12 studies, we see some changes, some improvements. Again, kind of going back to that first review that I showed you, we see slight improvements when we compare to a control group. Oftentimes, we don't see as much statistical significance between the intervention and the control. And through these studies as well, there are a variety of different secondary measures. Really no consensus that we can come to yet on saying what else is improved, right? As James mentioned too, that we see a lot of chronic conditions, poor sleep, anxiety, depression. And so very similar thing with the small amount of studies that are looking at some of these secondary measures. We're really not sure yet how yoga can be used as a form of exercise, as a form of this complementary approach to improve PTSD symptoms. So a lot of limitations from the current research, very small sample sizes in general, fairly high rates of attrition. Importantly, variations in type of yoga. So as I mentioned, depending on the yoga that's used, some forms tend to be more focused on breathing modalities, meditations, maybe really lacking in that physiological movement, and others are extremely high intense in terms of movement. And really importantly too, very limited physiological outcomes. So if we're wanting to study yoga as a type of physical activity, as a type of exercise, then I think we also need to measure, is it actually improving anything physiologically? And when I'm talking about that, I'm referring to more of those health-related markers of fitness, muscle strength, aerobic fitness, body composition potentially. If we don't have that mechanism change, we can't necessarily say that yoga in itself is associated with those improvements in PTSD symptoms.
Thanks, Rachel. So kind of get back to our approach. So that figure that Rachel showed that U-curve for individuals who do have PTSD, you see that people who have greater severity are either not exercising at all or they're very vigorous exercisers. And that is very much tapping into that high aerobic. And that very much led to the discovery of us considering an alternative to vigorous exercise to study the benefits of that as potentially therapeutic, especially for those people who maybe have tried aerobic exercise as a coping mechanism or as an avoidance mechanism. So that led to our team, some who are in the audience today. So we actually took a very multidisciplinary approach to kind of trying to answer this question. And the question being, can yoga be therapeutic for veterans with PTSD on the mind, on the brain, and on the body? So we surveyed the differences in physical activity behavior among a small sample of U.S. veterans in southeastern Wisconsin. And we also designed a small feasibility study to execute a yoga program for a small cohort of veterans at Marquette campus. And so our team is very multidisciplinary. We have Dr. Miller, who is part of our team as well, Dr. Jeff Little, and Dr. Zeno Franco. For those of you who know Franco's work, he's a community member, very much engaged with the veteran community in southeastern Wisconsin, and he's really integral to our team. So we've been working only a couple of years together. This is our third year of data collection and writing papers. And so what we wanted to tell you today or demonstrate what we've been able to do, we have 2 papers out on the work that we were able to do in our meta sample. And I think the take-home message is, and what we're always talking about in our research conversations, I'm a neural scientist, so I'm invested in this work because I'm interested in how the brain is processing exercise. But you can't even get there because there's lots of barriers to this type of engagement. So there's barriers to entry for exercise in general, and as I'm going to demonstrate, there's barriers for yoga in particular for this population. So we've been kind of stepping our way, so to speak, through this research together and kind of backing that train up every step of the way to try to better understand how to develop a program for this population that's actually going to be effective. So the purpose of this first study that I'll show you was just to examine and do survey data of southeastern Wisconsin veterans on their opinions on exercise in general, and to try to understand precisely those barriers to engaging in exercise. So we administered a survey to over 80 veterans. This was done in 2021. And again, the purpose there was to investigate differences in actually not just their exercise behavior, but their perceived efficacy to engage in exercise, which is a really important psychological concept, right? Not just their physical barriers, can you get out and do exercise, but how confident do you feel in that ability? So perceived self-efficacy to overcome barriers to engage in exercise, and then also we did query them about the actual amount of exercise that they were doing. And then we wanted to also look at some heterogeneity in our sample, as I'll kind of stress as I talk through these slides. We often assume in all of our work, no matter what population we're studying, we often assume a very homogeneous group. And yet, especially when we talk about trauma work, when we talk about veteran work, those groups of people are very heterogeneous. There's lots of different types of experiences that they come to the table with. And we learn a lot in our work together about, let's just take sex differences as an example. Men versus women have different conceptions about if yoga is for them. And we do see some of that some findings like that in our data. So one of the questions we had, just from a trauma psychology perspective, is what is the effect of cumulative trauma exposure having on your ability to engage in exercise? I'm going to come back to that in a minute. That's really important. So like I said, in 2021, we completed a survey with over 80 U.S. military veterans. This was our inclusion criteria. We just looked at adults, so over the age of 18. This was done online, so access to the internet was inclusion. And really in kind of this broader region of southeastern Wisconsin. And this was an English-only survey, I should mention. And these are the specific measures we were interested in. To that purpose slide a couple of slides ago, we were really interested in self-efficacy to engage in physical activity or exercise. And then we also asked these individuals to log their actual physical activity in a typical week, reported as metabolic equivalents or METs or METs. And then we also did a second thing in the survey, is that we queried PTSD symptom severity using a very standardized self-report checklist for DSM-5. And then one other thing we were interested in is trauma type. So for those of you who are trauma researchers in the audience, we used what's referred to as a criterion A approach to trauma. There's lots of discussion in the trauma world about capital T trauma, little t trauma, complex trauma versus single incident trauma. What we were trying to do here is just get a very quick snapshot using a very standardized approach to quantifying trauma, using what we refer to as criterion A in the DSM. And so we queried individuals in terms of whether they had experienced trauma that was assaultive in nature or resulted in serious injury, whether they were exposed directly or indirectly to their trauma, which is sometimes very important. And then this last piece is actually critical, real or threatened danger, in terms of usually one of the best markers of prognosis after trauma is whether an individual feels that they really were at threat of life. The critical piece here is that these were not mutually exclusive. So, for instance, we could have multiple check marks for each of these, for each individual. I should note that everybody in the study was exposed to combat, so we also know that at the bottom level there's combat exposure, but on top of that we're trying to query what else has occurred in the lifespan. In terms of data analysis, we were interested in looking at group differences in perceived efficacy to engage in exercise or physical activity, as well as the physical activity metrics by trauma type. So whether an individual says they have experienced assaultive trauma versus not, or experienced a direct exposure versus not. And then we also looked at cumulative trauma burden, how many incidents over the lifespan is related to self-efficacy as well as engagement in exercise. Here is a consort chart of our sample. We had 84 individuals who responded to our survey, and I'm just going to dial down all the way to the bottom to show you that. One key point here, which is actually very in line with what some of the other speakers have talked about. We had a pretty good survey response in terms of people feeling comfortable to talk about exercise behavior. But we actually intentionally queried trauma type and trauma severity symptoms at the very end, and that's where we saw some drop off in our sample. That's a point just to state that there's a lot of barriers to people wanting to engage in this discussion about their own traumas, and that's something that we're learning a lot about and it informs our work. Okay, so our final sample size for looking at the relationship to trauma here are 41 when we look at effects of self-efficacy, and 34 when we look at effects of actual exercise output. What we found, not necessarily surprising, but very good to note for the field, is that our sample, who indicated that they did have sexual assault and traumas in their history, were more likely to be female, not surprising. And we'll come back to why this is important in a second, but no other demographic differences existed with respect to our trauma variables. Also, very much in line, we know that those women predominantly, or female-identifying individuals predominantly that reported sexual assault, they in turn report less physical activity than their male counterparts. And we'll come back to this as well. But our main findings from this is that we did find that individuals who experience more trauma burdens, more cumulative traumas over their lifespan, not just combat, it's more than that, experience not only less self-efficacy to engage in exercise, so lower trauma burden having more self-efficacy, but they also did not engage in physical activity to a greater extent. And this is important. These are pretty robust effects, so this is important because it gets back to that issue of not all samples are homogeneous. There's great variability, especially when we do trauma work, and we have to think very carefully about prescribing exercise to this group in terms of what's going to work for who and modify when needed. So, in terms of some conclusions, some really important conclusions in terms of when we think of physical activity or exercise programs, even if you're a combat veteran, and we don't talk about maybe the assaultive nature of that can come with that in terms of women can report more often being victimized by sexual assault, just that experience alone is going to make it more difficult for those individuals to get into an exercise program. That's what this data is saying. And we can say that across all veterans, trauma probably matters for whether you feel motivated to get into exercise and actually do it. So with that was kind of our survey data that I walked you through, and Rachel's going to outline our feasibility study results.
Thank you. All right, so following, as Jacklynn mentioned, that initial survey study, we performed the actual intervention, really to just look at if having a yoga intervention on a university campus for veterans in the area is feasible. Is this an area they're gonna feel safe to come to exercise, to engage in yoga? And then we also were, again, really interested in those physiological health-related fitness outcomes, right? Is yoga a strong enough stimulus to potentially warrant some of those changes that are more commonly seen with aerobic exercise or resistance training? So, main outcome was PTSD symptom severity, psychological outcomes that typically included in general studies, overall physical and mental health, sleep, mindfulness, and self-efficacy. So again, self-efficacy tends to be a main focus of our research. From those of you in like the behavioral, or come from behavioral background, self-efficacy has constantly been associated with engaging in physical activity. And why is that important when we think about that as a construct target for interventions? Is because self-efficacy can potentially be changed. There are sources of self-efficacy. You can potentially teach or give individuals the tools and the skills to improve their own self-efficacy, to improve their confidence to engage in physical activity. So it's not only giving individuals, participants, means or access to a yoga intervention, but teaching them, right, to improve their confidence or their ability to engage. So it included that as a measure, and then physiological health-related fitness outcomes were body composition and muscular strength. So participants, as you can see here, again, this was specific, so only veterans who received a diagnosis of PTSD or probable PTSD based on the PCL-5, willing to attend testing and yoga sessions that were in person. So we were fortunate to be able to do this, again, an in-person yoga program on the Marquette campus, and then also individuals who are not already practicing yoga. For feasibility, we're really interested in looking at our ability to recruit individuals who are then enrolled, and then also adherence to the actual yoga program. Used the PCL-5. We looked at demographic and military characteristics. PTSD symptom severity was assessed by two of Jacklynn's graduate students using the CAPS-5. Psychological outcomes, as I mentioned, overall physical and mental health using the SF-36, Pittsburgh Sleep Quality Index. We're also really interested in looking at mindfulness. So as I'll talk about in a little bit, the specific yoga intervention that we used was strongly based on mindfulness and also a specific construct they called mindful resilience. Resilience, the ability to potentially overcome and adapt to stressors. And then the yoga self-efficacy scale, how confident was an individual in their ability to engage in yoga. Body composition, we looked at height, weight, fat mass, lean mass, and bone mineral density using a DEXA scan, which is very similar to an X-ray machine, but it can quantify the difference between muscle mass, fat mass, and bone mineral density. And then for muscular strength, we use a very simple measure of hand grip strength, which is used as a dynamometer here. Pretty surprisingly, hand grip strength has very consistently been associated with being able to predict mortality and morbidity, especially in older adults. And so we use that as a measure of strength. So as I mentioned, the intervention that we used was called the Veterans Yoga Project. It's a national project that our yoga instructor went through an online training to be kind of certified or established in what they recommended in terms of that mindful resilience approach. It was a 12-week program, 1 hour per week. The weekly session included beginning with a seated breath awareness meditation, some seated breathing. That mindful movement was where really that exercise component came in. And if you ask the veterans who were in this study, they would say it was definitely higher intense movement as well as some guided rest. So the dates when it occurred in early 2022. Here's a picture of the space that we used and a few of our sample of participants engaging in yoga class. So we really just looked at the differences before and after of this 12-week yoga intervention using paired samples t-test. Because of the small sample, we're really focusing on using or looking at Cohen's d effect sizes with small, moderate, and large effects of 0.2, 0.5, and 0.8. So here's a consort diagram of individuals. So 40 individuals made contact with study personnel and were assessed for eligibility. 17 were enrolled in the intervention, 3 withdrew before testing, 14 completed that pre-intervention testing, and 12 completed the post-intervention testing. And so our goal sample, based on funding and space restrictions, was 15. So we were very close to our target sample, which we were excited about, but there are, I think, over 30,000 veterans living in Milwaukee County. And so I think that still tends to be a question that we have is how do we improve that recruitment? How do we get more veterans interested in yoga as a potential exercise modality? But when we look at those who actually were enrolled and completed the yoga program, 10 of the 12 participants completed over 75% of the 12 sessions. So once they were enrolled and started engaging in the yoga program, they came, they liked it, and they enjoyed the ability to engage in that with other veterans in the same space. So this is just some demographic data looking at kind of what our sample looked like. So average age was 50 years old. We had 75% male, 25% female. We also had kind of a different breakdown among different branches of the military. Majority were involved in some sort of combat, and you can see our average PCL-5 score was 40, indicative of potentially probable PTSD. So when we look at just our primary measure of PTSD severity, you can see here the breakdown of the different categories, so re-experiencing, avoidance, negative mood, and hyperarousal. And again, we don't see any significant results in terms of p-value. Most of our Cohen's d values tend to be trending towards seeing an improvement, with the exception of hyperarousal. But again, with a small sample size, this is kind of what we're expecting, and potentially trending improvements in some of these measures. When we look at our other measures of psychological health, we see similar results, right? No significance in our p-values, but trending improvements in most of the outcomes. And I really want to focus on this mindfulness. So as I mentioned, we included mindfulness because it is such a strong component of most yoga programs, most yoga interventions, and specifically the program we used with a focus on mindful resilience tended to be a large feature. And so we were excited to see that some of these components of mindfulness, observing, being able to describe, non-judging of inner experience, which is, we saw a significant improvement in that ability, that component of mindfulness. And so we were excited with this result, showing that going through or engaging in a yoga program with a focus on mindfulness actually resulted in some improvements in that aspect as well. And then our physiological measures, again, this was kind of a novel inclusion. We don't see this included in as many of the, especially the yoga interventions and as a modality of exercise for veterans with PTSD. Similar results kind of across the board. We don't see any significant improvements from before and after the 12-week intervention, but almost all of them are improving in the right direction. And we see kind of moderate changes in lean mass or muscle mass, as well as hand grip strength. And so not super surprising, given that the intervention was 12 weeks, just 1 day a week of engaging in a yoga intervention that in itself incorporated some of the more intense movements, but it was really a focus on mindfulness or that mindful resilience aspect. So in conclusion, I feel like we demonstrated that it was feasible to have a yoga program on the Marquette campus involving veterans in this area, although we still need to, we're still working on ways to strategize to increase recruitment, also increase the acceptability, the social acceptability of yoga as an exercise modality, but the potential effectiveness of yoga as an alternative or a complementary treatment for PTSD in the veteran population.
So a couple of thoughts, I'll give you some just overall considerations from what we've been learning. This is pretty hard work to do, I think we're finding out, and we're starting to see that maybe this can be an alternative approach than high-intensity exercise for the veteran community with PTSD. You'll notice that we didn't get a chance to look at trauma characteristics in our feasibility sample as what happens in research processes. We actually didn't. We completed the feasibility study before we got the chance to ask those questions or input them into the feasibility study, so we're hoping to do that in the second feasibility study that we're currently planning. I think overall considerations, again, to double down, there's lots of heterogeneity in this sample that want to be considered and mindful when we develop exercise programs, so not necessarily a one-size-fits-all approach. And we have a lot of insight in terms of special considerations for prescribing physical exercise. We didn't get into so much of the intro here. A lot of people have already touched upon it, but this is a population that is often comorbid with chronic pain. And that's one of the biggest barriers that we heard. We actually did focus groups and qualitative data that we're not describing here. But that's one of the big pieces of feedback from our population is that a lot of the other exercise modalities doesn't really apply to them. They can't get physical clearance to do it from their physician, or they're scared to engage in that because they have chronic pain issues. So we are trying to be very mindful of that. We think that this can be a possible alternative approach, yoga in particular. So we're very interested in that. And just to kind of double down again, as it's been highlighted, right, this is a highly chronic sample. We talked, Rachel demonstrated that in our sample we had Vietnam veterans as well as OEF, OIF, OND veterans in our sample, which was very exciting, older to younger spectrum, which was huge. And they were all really interested in it, but that comes with, there's a lot of comorbidities with this sample. They've been living with PTSD a really long time. So we actually are really interested in something new to try. So kind of our approach has always been trying to develop therapies or be very mindful of the physical and the mental health component because of this reality for our population. And with that, we're happy to take questions. So I mentioned that we did a focus group. We didn't present that data today, probably should have. But we did a focus group with these folks. And one of the things that we learned about the focus group is two things. They really liked the mindfulness-based approach of it. I heard another term, someone else used this term. They really used it as a tool in their toolkit. So to be able to learn that practice, to be able to store that information, go home and practice it was a big benefit to them. So that's what we learned a lot about. I think the other thing we learned in the focus group is that identity matters. It's probably true for lots of populations, but they liked being able to be in a space with other veterans, but not having to disclose that information themselves. That was huge. So there's sometimes some stigma about self-disclosure that I'm a veteran. Sometimes, they might have feelings about that status. We heard from one of our veteran members that, I don't tell people that I'm a veteran. You're only going to know it in very special circumstances. Nevertheless, so not having to talk about that, right? Kind of getting back to, I don't have to talk about my trauma, but I'm in a shared space that I know that the other people in this room get it, was a big motivator to keep showing up.
I think to follow up too, and some things that we've talked about too is the aspect of social support as well. So as I mentioned, this was a group-based program, and so it was coming into a group or a room, as Jacklynn mentioned, with others who were similar to me or similar to them as veterans. And so we really had too small of a sample to kind of tease out, right? Are there anything that's moderating, right? Are we seeing this improvement, potential improvement in PTSD symptoms or mindfulness, right? What is that aspect of social support, or what is that role of social support, which I think will be important to tease out going forward. Any other questions? Oh, okay. Yeah.
I just need to know if in your personal experience or your understanding of how the VA works and all this, would you think it would be more helpful and in terms of organization and just general ability to co-organize if there were more fitness professionals employed at the VA and things like that, or if you think it would be more helpful to have a better referral system?
Yeah, so that's something that we're very interested in as well. Most of our data comes from VA, and some of the new data that's coming out is showing as well is that all we know is if they're interested in engaging in yoga or fitness programs at the VA, not as much of community-based programs. And so I think there's a lot of veterans who don't use VA services who potentially want access to some of these, as you mentioned, specific classes or programs that are for veterans, but it's not something that they need to necessarily talk about or share. And so I think that's that's kind of what we're thinking of. Next approach is how do we potentially promote activity and exercise for those community dwelling veterans outside of the VA? Does there need to be more of a promotion by fitness professionals of having things in the community that are specific, such as Team RWB and other programs like that?
That's a good point. I'll just say one more thing too. When we heard from one of our veteran members that they actually prefer it to be in the community, kind of getting back to that idea that they don't really want the trauma piece to come along with this. So they're happy to work on both of the things, but maybe if they can work on the physical health elsewhere, the trauma rehabilitation will come after. So maybe separating them apart for some people is actually the motivator. Yeah.
Okay, then as a follow-up question, when you have these community events and stuff like that, do you think it would be more useful to have it advertised as for veterans, or do you think it would be more useful to have it as just hey, this is for everybody, anybody can come and just have veterans be able to join those?
So I think our veterans told us both. They told us that some of them really wanted that identity and some did not. And this is particularly true if we think of men versus women veterans too. Sometimes, the idea did come up. This was a joint gender group, and we had both male and female, and it worked great. But there is probably the next stages is doing separate groups. There's a lot of stigma in terms of men maybe not seeing it for themselves. But also because women are less represented in the veteran community, they don't feel represented in that space either. So, yeah, both sides.
And just to say, I think it's, as we've talked about, it's so individual specific. In our sample, we had one of our older veterans who was a male who, came up to me after the first class and said, I think it'd be really cool if we all brought in a picture of us when we were in service and we can share it and post it. And I had emailed then individual participants and said, would this be something you'd be interested in? And I had many of the female veterans say, I don't want to do that. I don't want to share that. And so I think that was something we really learned, was that it is there's so much heterogeneity, again, just to finalize with that. So, yeah.
Thank you so much.
Yeah, thank you.